The Mind Health 360 show is brought to you by the London Integrative Mental Health Clinic, which provides the full 360 degrees of mental health, diagnosing and treating the root causes to your mental health symptoms. To find out more, or if there's anything in this episode you'd like help with, please find us at integrativementalhealth.com.
And it was pretty clear to me, after a while in psychiatry, you can follow the cookbook and it's actually kind of boring to me. It's like you do it, and some people get better and a lot don't, and you go to the next level. And you can be happy with that, or you can just start trying to wonder, it's like, really a lot of people don't get better and they are just so sad and so unhappy. Are there better ways? And the research is really clear. Antidepressants don't work any better than actually placebo in many cases, where, they're pretty equal to placebo. And many studies showing things like diet, exercise, supplement interventions work as well.
Welcome to the Mind Health 360 show. I'm Kirkland Newman, and if you, your loved ones, or clients suffer from mental health issues such as depression, anxiety, insomnia, poor memory, poor attention, mood swings, exhaustion, etc., I interview the leading integrative mental health practitioners from around the world to help you understand the root causes of these symptoms, many of which may surprise you and suggest solutions to help you heal. If you like this interview, please do subscribe and forward to others who might find it helpful. If you want further information, please go to www.mindhealth360.com or find us on social media. Dr. Mary Ackerley, thank you so much for being here on the Mind Health 360 show. You're a classically trained, board-certified psychiatrist. You're a summa cum laude graduate of Harvard University. You studied at the National Institute of Mental Health. You finished your residency at Johns Hopkins, and you were certified in psychiatry and neurology. You also hold active medical licenses in Arizona and Florida. You're a co-founder and past president of ISEAI, which is the International Society of Environmentally Acquired Illness. And it's a professional society dedicated to the teaching and researching of environmentally acquired illness. You've worked with Biotoxin illness since 2010, and you were the second certified practitioner in the Schumacher protocol in 2013. You're also board certified in integrative and holistic medicine and a member of the Arizona Homeopathic and Integrative Medical Association. Your internet article entitled Brain on Fire is a summary of the psychiatric implications of biotoxin illness. Now, there's a lot more, but I'll put that in the show notes. But I mean, you're an incredibly accomplished, very impressive psychiatrist and practitioner, and you have a lot to say. So I think what I'd like to do is start to ask you, what pushed you into sort of integrative and functional medicine psychiatry? You being a traditional psychiatrist, what was your journey to that side of things?
I get asked that a lot, and I think my insight changes all the time. We don't really know how we end up where we're going to end up. When you look back and I'm listening to you read this, sometimes I don't even recognize everything. So it's been so long ago, and there's always just been an evolvement. So the integrative part is, psychiatry I was drawn to just, I think, from my own early childhood traumas with the death of my father. And that really sets you up for being a lot more sensitive to the fact that life isn't always peaceful and wonderful, and certainly taught me a lot about sympathetic overdrive and without knowing the words of. And I've just also intellectually, the brain fascinates me. So there are those two things. It's like there was nothing else. Neurology would have been great, except at the time I was doing neurology, we used to have some catchy saying, but it's basically the diagnosis is wonderful, but then they all die. There were no treatments for neurodegeneration. And even now we have more treatments, but psychiatry has always, seemed more promising in terms of getting people better. And I think that since then, it's just been my own journey through patients, and as well as my own personal preferences. I just seem to have some stronger preferences to want to do things in a more organic way that's always included diet. And it's always included some exercise, and it's always understood you don't live in isolation where you just have one neurotransmitter wrong and we fix that and everything else will just shape up. So, and it was pretty clear to me, after a while in psychiatry, you can follow the cookbook and it's actually kind of boring to me. It's like you do it and you do it, and some people get better and a lot don't, and you go to the next level. And you can be happy with that, or you can just start trying to wonder, it's like, really a lot of people don't get better and they are just so sad and so unhappy. Are there better ways? And the research is really clear. Antidepressants don't work any better than actually placebo in many cases where, they're pretty equal to placebo. And many studies showing things like diet, exercise, supplement interventions work as well as many of the antidepressants we have. So, and that's been around for the last 10 years really strongly. And most drug manufacturers have even stopped making traditional antidepressants because the old stuff, Prozac, still really works if an antidepressant is going to work. So I think all of those things, and then my own quest for just health and happiness is like, health and happiness is not going to be found in Prozac. I mean, it was been around since '87, works. I remember taking it towards the end of my residency and going, wow, miracle, but it's not a miracle. Life is still, you still have to make decisions, you still have to go on. I think much later in life, I realized, I was living in a 100-year-old home. We were renovating for years. There was mold in the basement. It was just like, do you think that had anything to do with just not feeling too energetic and happy about things, So we keep learning layers and layers and why things didn't work. So in some sense, if you ask me the whole thing, I have a predilection towards psychiatry and understanding human suffering that I'm no stranger to. And that I'm a very honest person. When things don't work, I tend to say that it doesn't work instead of trying to say, well, it doesn't work because that person didn't do it correctly and you didn't follow that protocol. And I've heard all of these excuses most of my life for things that don't work as the other person's at fault.
Interesting.
So that's kind of where I am.
Well, that's
and always looking for like, what's the next thing nobody seems to understand that's actually really important.
Absolutely. And your article on, the brain on fire, which is absolutely fantastic, which is all about neuroinflammation. And, you talk a lot about biotoxin illness, obviously, but you also talk about infections and, other things, other sort of mediations of inflammation. So can you first tell us maybe a little bit about biotoxin illness? Like, what is that and how does that impact our mental health?
So, realize I live probably in a state we're sixth in the country in Arizona in mold, which seems really surprising. But mold is extremely common, and it's a lot more commonly known and understood in the US and in the rest of the world, I think much more in England so than 10 years ago. So biotoxin illness is a more fancy word for mold illness, people living in environmental inflammation. And it turns out there's a lot more that grows in a water-damaged home than molds. There are all sorts of fungi and gram-positive and negative bacteria like actinomyces. There's mycoplasma grows, and people always forget this. Mycoplasma grows in water-damaged buildings. So there's a lot of stuff that grows, and there's a reason we have houses and don't live in the wilderness. We're protecting ourselves from the elements. And these kind of pathogens cause inflammation. And that's really well documented that they cause inflammation in the body. It's what we now know with COVID is cytokine illness. A lot more people understand the role of cytokines, the inflammatory substances produced by the immune system. But biotoxin illness does something very similar. And it affects, of course, the brain.
And this is what interests me, because you say in your article there's a huge amount of research that backs this up, that backs the fact that, in the psychiatric literature that neuroinflammation causes, depression, anxiety, psychosis, suicidality, neurodegeneration, etc. Why, and yet it's not in clinical practice. Why do you think, or not commonly in clinical practice? Why is that?
One thing is just it's too complicated for a lot of doctors and patients to really want to address. That's part of it. I'm a person who does look for silver linings. So in some senses, COVID is making it harder and harder for people to stop pretending that, that we don't understand why people have brain illness, and B, that there are simple solutions. So the long hauler is becoming much more recognized. I haven't seen anything in long hauler symptoms that I haven't been seeing in my chronic fatigue patients from Biotoxin in line for the last 10 years. And the brain is always mentioned. Every article, people get COVID, it seems to be a minor case, and their brain is affected. And it does enter the autonomic nervous system. But most doctors are saying, or people really studying, it seems to be the inflammation that's been caused, that causes what surrounds the brain, our blood-brain barrier, to become inflamed, and that's causing the brain fog, that dread word that's always, but that's not scientific. We can describe it in longer what it is, but most people, once they've had it, know exactly what you're talking about with brain fog, slowed processing, slowed mental awareness, word finding, focus, attention difficulties, the fatigue, certainly depression and anxiety. So it's a long way of saying it is becoming more recognized. Every time I talk about this or do a talk for some conference, I'll go and look at the latest literature for the last year. Doubles like every year. It's, new cytokines are found, new research is done, new meta-analysis. I've never seen one that says, there's no link between inflammation and the brain. It's clear. And in fact, now latest stuff that's come out is we have the astonishing research that inflammation is linked to neurodegeneration. And it's very exciting because this inflammatory substance, what things that basically would be fixed by fatty acids in diet, it's an inflammatory substance given off by the macrophages, and they found in mice that when they reversed it, and they evidently have a drug that's stronger than, say, evening primrose oil, which is what a lot of people have used. It's prostaglandins. And the mice all regained their awareness and focus. And it's exciting news. Well, it's exciting, and it is exciting to me too, because it seems stronger. And there's a point as inflammation just keeps going on chronically in people. And as they age and their body doesn't put out hormones, the immune system, the thymus, which protects us with T cells, is like senescent after the age of 60. A very frightening fact when you actually read that, and it's like, yeah, and those are where people are going. Is the immune system and the hormones are all, decreasing in efficiency as you age, that we're going to see more and more cognitive decline and less ability to fight inflammation. So, again, I've taken a long road here too, but it's just like, hey, the research is there, and I think you're not going to really even find most scientists at this point wanting to argue this point. It's the practical implication in people's lives. Psychiatrists are trained to, 30 minutes, get the symptoms, give a drug, and it is a faster approach. And they learn to not be totally honest in their minds about the fact the research just really isn't that great for the long-term outcome of what they're doing.
Interesting.
And neurologists are in the same boat, and we're all looking at this, tsunami basically of, we know Alzheimer's and neurodegeneration, and now the long-term sequelae of COVID.
Good. So, absolutely. So neuroinflammation essentially could explain any sort of psychiatric symptoms. So depression, anxiety, suicidality, neurodegeneration, psychosis, any of it could be mediated essentially by inflammation.
It's the kindling. It is the fire, and then it hits specific areas. The fire affects specific areas in the brain, specific parts of the immune system. So there are different pathways in different ways, but yes.
Yeah.
And even if you go to any of our long-term chronic diseases, people are just going to say it's inflammation. It's the small, slowly smoldering fire of what was effective but keeps going, that keeps the body turned in a way. It's attacking things that aren't really there and destroying brain tissue, other cardiac tissue, lung tissue in the body.
Exactly. And one of the things Because if we look at cause and effect, essentially, so, what are the things that can cause neuroinflammation? And, there are several different pathways, I guess. There's the autoimmune system. So, and there's the microglia, there's the cytokine system, there's, reaction to various different infections, reaction to biotoxins. So what are the main causes, you would say, and the mechanisms for this neuroinflammation?
Well, you've just named a whole bunch, because under every one of those headings, we could have 6 subheadings and discuss all of those. My focus has been, someone asked me once recently, so what are the main things you use for the brain? And hoping I'd give them a list of 3 things, a little protocol that if they did this, they would fix someone's brain. I just started laughing because and I started thinking, well, how do I think about this to explain to people is, once we've assessed there's a brain issue, a neuropsychiatric issue, whether it's going to be neurological cognitive issues like brain fogs, more severe cognitive issues, more like dementia, tremors or neurological, psychiatric anxiety, depression, OCD. And trying to get the specifics, it's the first thing I'm going to go for quick fixes, which is diet. Very few people I meet in this condition that I can't, find some very common, well-known causes of inflammation. Too much sugar. I've had doctors ask me, do fruits count as carbs? Which like, yeah. Yeah, once it hits your saliva, it's all the same. So it's our medical education is not terrific, is somehow many people, when people say I eat healthy, it's like I'll smile and say, that's great. You'd rather eat healthy than not healthy. Can you tell me what you mean? Because everyone's idea of healthy is not the anti-inflammatory diet. So I can really I'm always looking to get people basically on a low carb, autoimmune paleo diet, which means quickly getting the carbs below 50 grams, getting people off gluten and dairy, and then just dropping real junk food. And that actually makes a difference. And you say, well, that's not much. Well, it's actually for some people still an enormous jump, because you have to go over the healthy things they're eating that are causing major problems. So diet is like, without a doubt, it's the food, it's the medicine we eat every day. It starts to sound really boring, but when you're battling inflammation, the first thing you do is, yes, we all know about COVID indulgences and stuff like that. But after a while, you realize that excuse is running out, and that you're going to have to learn to at least eat keto brownies, okay? And still drop the gluten and look, inflammation's inflammation, and food and poor choices in food and not eating organic just cumulatively keep increasing and can quickly make changes. That's what I tell people is really, it's worth doing it. It's not just to lose weight, it's to feel better in your brain. So working on a diet that I would call basically a paleo autoimmune, and low carb, and taking off obvious offenders. And then the next thing would just be fish oil. Love fish oil, really works. And in the beginning, there's probably nothing better, because most people are very deficient in the anti-inflammatory oils. So part of the diet is getting them off all the vegetable oils, all the people who are not eating oils because they think it's causing a heart attack, because that is so ingrained in people still, no matter how much it's been said. Fats are really important for the brain. The stronger message that, people have heard, you will die if you eat fats from cardiac, is that message is stronger. So I still get a lot of people who are terrified. Olive oil is a wonderful solution for most people. I'll hear people say, well, I have phenols, and it's like, we're getting into now very specific things. Most people, combination of like 4 grams of fish oil, a good quality fish oil, and olive oil, like a tablespoon 3 times a day. And I have people drinking it for its anti-infective, is going to fit pretty quickly. I've had bipolars tell me one or the other, like guzzling fish oil out of the refrigerator. I've had a few do that. And more recently, a couple of people said, my God, you put me on the olive oil. And I started guzzling that too. And I just been doing, like you said, a tablespoon 3 times a day and putting it on everything. And I'm doing keto, and my moods I've never had them so steady.
Wow.
So worth, again, where you're starting is going back to the basics before we get really fancy about lion's mane and the peptides and stuff, is just, the food and the oils. And then we can go into phosphatidylcholines and stuff. But you can get really far with fish oil and diet, and people get so bored, it's like, nope, really important. And then trying to work with gut inflammation a lot, which is going to go down with changing diet and using better oils, and then maybe a good probiotic, a good antihistaminergic, because histamine is a very potent cause of problems in the brain, like Lactobacillus rhamnosus, which helps the vagal nerve. I like that one. I like spore probiotics. I like probiotics that have never caused anyone an issue, because I get tired of people taking probiotics and they're worse. These tend to be very safe. So working with the gut, working with the oils, working with food takes people a long way. And I'll get people who think they're going to get around all of this because they take, 15 supplements recommended by Bredesen. Well, I'm taking all of this and the Neuroprotect, and I'm taking this and the lion's mane and the vincristine and the ginkgo, and I still don't feel great. And it's like, yeah, your hemoglobin A1C is 6.5, meaning a ton of sugar in the body. So, if I get a gate message, if you really want to stop inflammation, you are always just going to have to be on a good diet, cheating in your mind where you forgive yourself. Your body doesn't really care. It doesn't work. Lots of people have been there before you. And exercise. And by exercise, I don't really mean high intensity aerobic. That's helpful for a lot of people. Exercise that's mindful and conscious and allows what we call a structural integration of the body, starts to release trauma, starts to improve the vagal system. And when you can improve your autonomic nervous system, which is connected right around here to your brain, you're going to get a lot more health going in the gut, in the lungs, in the heart, and in the brain. So I tend to really favor for exercise these days Qigong, because so many of my patients have some dysautonomias, some real problems with integration with eyes and audio and hearing, and that mindfulness of breathing and movement. I've never had anyone been able to say, I just can't do it. And there's no way you can't twirl. I don't care your hands and twirl your ankles.
Yeah.
And it's meaningful.
Completely.
And so there are lots of things I can talk about there, but these are all ways to approach with food, diet, and exercise a really healthier lifestyle that keeps this kindling from always being there. And then the minute there is a trauma, a pathogen, mold spores, a traumatic event, your body doesn't fall apart into depression.
I think it's really important, because essentially what you're talking about is the terrain. So the terrain, your body has to be resilient, and you have to really make sure that it's resilient enough so that, when the proverbial SHIT does hit the fan, which it will at some point, whether it's biotoxins or infections or trauma, as you say, that you're more resilient to the, inflammatory process that will happen. And I'm interested because you keep talking about the vagus nerve, and, I find that fascinating. How does the vagus nerve mediate inflammation? What is its role in inflammation? I mean, I know it connects, the gut and the brain and the heart, and it's a big connector. But what is its specific role in inflammation? Do we know that?
I think there are a number of studies. And I think the simplest way to understand it is it's the longest nerve in the body. So it does run from around here, which is really important. I keep pointing here because the amount of problems people have at the intersection of their skull and the beginning of their cervical spine is enormous, at least with what I'm seeing. And it is related to anxiety and depression too. But so you have the vagal nerve running on both sides, and it's the longest nerve, and it is traveling through heart and lungs and gut and diaphragm, going all the way through the gut. And so it is your parasympathetic nervous system. It is the relaxer. It is, when it's overdone, the break. And there can be problems. And it's a lot of the people I see with chronic fatigue. But the healthy response is you have a very balanced parasympathetic release of neurotransmitters, hormones in the body. It's where we rest and digest. And honestly, if you are sleeping through the night and digesting your food, even if you're not eating always the right things, you're going to be so far ahead of most people who never give themselves the time to digest, whose sleep is poor, who keep getting more anxious and more bent over and tight and get into this very poor circle. So all of that, when it dysfunctions, leads to more inflammation.
Yeah, and it's very interesting. I was interviewing a doctor of osteopathy, in fact, who was talking about how, all these nerves around here, around the neck, the back of the neck and the tongue are very important for the vagal system, and, how people get really blocked in these areas, and these blockages create these sort of breaks in our energy flow, our circulation, our lymph flow, etc. And these are not things that we think about in terms of mental health, but, probably we should. And then coming back to the causes of inflammation, I mean, I know you're a sort of specialist in mold, but also, infections, things that we don't necessarily think about. I mean, not many people, for instance, know that a poorly treated streptococcal infection, which can lead to PANDAS, which is this pediatric autoimmune condition, which can then lead to psychiatric symptoms, or Lyme disease, toxoplasmosis. So all these things that we wouldn't necessarily, and as you say, COVID, associate with psychiatric symptoms. Can you talk us through a little bit? I mean, essentially, if somebody has these psychiatric symptoms, should we be looking, based on, I guess, their circumstances and their symptoms, should we be looking for infectious causes, viruses, bacteria, and
Absolutely.
Yeah.
Absolutely. And I would say first, going for the mold has just been my experience. And, part of my journey has been, as I was doing integrative psychiatry, maybe more than 10, 15 years ago, there was another doctor nearby in Tucson in Arizona who pretty well known for treating mold. And I would see his patients because I didn't know at that time mold really affects the brain through inhalational toxicity. And he would be treating them, but had a hard time addressing how anxious they were, how hormonally out of balance. And they end up seeing me, and at some point I began to stop thinking they were psychosomatic, which realistically has been my training and every other psychiatrist training, is you think you're breathing stuff behind the walls, which is making you crazy and have nightmares. Fine, let's do this. Would you like some Prozac? And we'll work on this. Right, as you think it's psychosomatic, but you're nice. But at some point I began to realize that they have a lot of labs here that are abnormal, which are things that were cytokines that are really well studied now in mold. And these could affect them. And I became curious too. And that's really how my journey has been. So it just turns out mold is very common. Yeah. It's really is hidden behind the walls. It's in the basements. The older the home, the more chance for water damage, and it's insanely toxic to the brain.
And what's the mechanism? Because this is what makes me quite curious, is, it's so sort of counterintuitive that these mycotoxins, I mean, is it because they activate the immune system that, so the body reacts to these viruses or bacteria or mycotoxins, and they mount an inflammatory response? Is that the mechanism?
There are several. Okay,
Yeah.
So there isn't one, but basically you inhale, and I think we all know from COVID now, as people are really catching up to where I've been for 10 years and a lot of others, you inhale, the nose is incredibly important, and we don't take very good care of it in Western society. So things pile up, and they go right towards your brain. And now we know the loss of taste and smell is a sign of COVID, and that's the mechanism. So mycotoxins do the same thing and are going in a direct route of entry, and they do kill. Some of them just will absolutely kill the brain cells, which we might consider the worst. But mostly what happens is kind of like COVID, is inflammation is set up, the body starts attacking and can't effectively kill them, in part because when we get to mycotoxins, they're a toxin, they're already dead, but the body is trying to kill them. and making a lot of inflammation that is causing the problems in the brain and in the nervous system, in the lungs tremendously, in the gut. So that's probably the major, but there it sets up all sorts of reactive oxidative species that, so people are in a very unbalanced oxidative state. And again, that's going to affect the brain. They just plain hurt all over. Their brains don't work. And they tend to, feel anxious or not sleeping because the brain and the joints and the inflammation is way out of whack, and the gut. So there are probably some other mechanisms we haven't understood, because most of this has been studied in, labs like Wuhan, really. Basically, trichothecenes, which are made by Stachybotrys, are a biowarfare weapon in the state of Arizona, at least in other states. So they are dangerous. We know they're dangerous. We know we can kill people and make them bleed, and do bad things. So, but when it's growing in your bathroom, everyone says you're psychosomatic, and this is not a problem.
And then so there's the inflammatory cytokines, and then there's vasculitis, which is inflammation of the blood vessels as well, and then the microglial activation. So there are different mechanisms, I guess, through which this neuroinflammation can act. And, and you also talk about brain injury. So if you get a brain injury, that can lead to sort of persistent activation of the microglial, the immune system in the brain. And that has a potential direct correlation with neurodegeneration, like Alzheimer's.
Usually there's neuroinflammation first, and then we're going to have neurodegeneration. But I think we'd all like to make these neat piles, like mold versus Lyme versus strep. The majority of people, as we get better testing, have all of it. And they've had TBIs because we're humans who hit our heads, and no one told us, to really take better care of them. Mold is growing everywhere. And that's the argument used. Well, it's growing everywhere. Well, look at civilization. What do you think? Do you think we're a really healthy, wonderful race? But there are many more toxic molds than there are lots of normal molds, but very toxic molds. But in the last 20, 30 years, whoever you want to look, is, pathogens carried by ticks and mosquitoes have multiplied because of all the various things going on in an environment. And we've, destroying people's guts at such an early age that they get a strep infection. Instead of it being kept here, it just starts wandering into the gut or into the brain. So the kids I see with pens is, sometimes it might be a pure mold, might be a pure strep, maybe it's just a pure Bartonella, which is what causes the vasculitis more than just, say, mold alone. It's Bartonella just seems to really love the endothelium of the small vessels. It's a combination of all of it in a body that hasn't been eating well, has had too many antibiotics already, doesn't have a lot of defense, and it's hitting everything that you talked about. So there isn't a neat box in most of the people by the time I get to see it.
Yeah, and I think that's the challenge also with integrative mental health and functional medicine psychiatry, is it is such a huge piece of detective work that has to happen to unpick all the different potential root causes and then how to treat them. And, it's quite a complex puzzle. And when you look at it, I mean, it's so much more complex than giving someone an SSRI. And
right, and I totally understand there are days I wonder, could I just flip some benzos and SSRIs and stop the whole other thing? Yet it's not honest. And that's kind of like what to me distinguishes people who can believe in things that don't really work, but will still do it, and people who are like, no, this just is not the best path. Is, if it works for you, you're going to be back in 5 years if that's all you do.
Well, I think that's the problem. It's about sustainable solutions, right? So it's basically
like that. That's yes.
You've got to get, sustainably better, essentially. And if we look at the consequences of neuroinflammation, I know I keep coming back to that, but the actual mechanism which fascinates me, it's so in your article, you mentioned that neuroinflammation can lead to decreased serotonin production, which I find very interesting, and also decreased dopamine production. So inflammation can actually decrease the production of key neurotransmitters for the brain.
Or increase the transmission of, that is a well-studied one pathway of kynurenine pathway. And basically serotonin, tryptophan are going down, instead of going to melatonin, are going down an inflammatory pathway that is pretty well shown to be more deadly to the mitochondria, to the microglia, and associated with suicide.
And so what causes the tryptophan to go down that quinoline pathway as opposed to the serotonin melatonin pathway? Is that because of the inflammation?
It seems to be.
Yeah.
The inflammation. And it's the major reason why you see people having what I call paradoxical reactions. Lots of people are put on antidepressants and they really do feel better. And I'm not arguing against it. I love your word, sustainable. It's like, it is a quick fix. And I'm certainly willing to do that if it gets you to a place where you can address the other issues that are clearly there. But sometimes you'll give people antidepressants and it will flip them. They'll become severely suicidal, insomniac, feel the worst they've ever felt, and blame it all on the antidepressant. Well, it was too much serotonin in a brain that's inflamed that just dumped right down the inflammatory pathway. So when you see that, it's a very clear call to me, not that antidepressants are terrible and I need to go join a society and blame people forever about how awful they are, but your brain is inflamed. It's about as clear a mark as we get. You need to start looking for the food, everything we've just talked about and more.
And so treatment-resistant depression, in your experience, you could say that is really because, of inflammation. So if there's a sort of inflammation, that will cause treatment-resistant depression in your experience.
Right, absolutely. It's the first thing I think about. And what a lot more doctors and psychiatrists too, even in patients in particular, it's like, I have treatment-resistant depression, meaning we've run out of drugs and I still feel miserable. That's when they maybe find on a patient book, it's like, there is mold growing in the basement everywhere. I was bitten by a tick, 10 years ago, etc. My diet does, no one's ever talked to me about my diet as they gave me, and I still hear that. So, and I'm also not going to say that we know everything because I've been doing this a long time. And I will say I do have a few patients where nothing we do seems to be able to flip them into a more normal mood. And I wish I could say, but it's part of the quest of like, there has to be something more. Why can I get like 95% of people better doing this and another 5%? I can't. So I think that probably drives me and other people too, is, so I don't like the fairy tale stories of like, yes, and if you eat this and do this 10 things now, you're going to feel better. 50, 60% of people will, but it gets very, very complicated at some level of why we can't unflip these switches.
I completely understand. And also I wonder if, because there is a whole trauma piece and sort of adverse childhood experiences piece. And, that interacts with the biochemistry and leads to biochemical imbalances. But I think it's all very well to take a very biochemical approach and say, let's fix the diet, let's give supplements, let's lower the inflammation. But there is, unless you're also dealing maybe in a somatic way with the trauma or with the...
It's why I've become so fond of, absolutely, the best research we have in medicine, I think, is adverse child experiences, is really, if you want to look at really strong evidence base, is adverse childhood experience lead to worse outcomes in every illness you look at. And mold and Lyme and PANS are no exceptions, So people say, do you think my trauma is affecting me? Totally. And it's absolutely the people that take longer. And everything I've learned, I try and use. And, some of the things is I'm not a big fan of addressing it again and again at all. I think we've shown that a while ago, is that you really need to stop activating those pathways and get the body to release. So sometimes I still am a detective even on there. It's like, some people have not, and therapy in that case is useful, but mostly I've learned to love things that involve moving the eyes, moving the body, freeing up the vagal nerve, releasing trauma in ways that we shake and stuff without talking about it so much, getting people to feel safe is really important, especially when we're telling them, hey, you need to live in a safe place. And they're running around the desert here. And this kind of gets to me, in tents and cars, which there's no way you can feel safe and grounded when you're escaping these toxins and changing bases all the time. So I'm really aware of safety, and will sometimes say maybe it's better you're living with some exposure, but the home is okay. And you can pay for it, and we can work on it. We can keep working on these things as you grow. So I see panic-driven behavior all the time, as I am working on a book, and certainly is a chapter on panic-driven behavior, which is probably the surest way to ensure that you are not going to get better, is to be running in panic from doctor to doctor, solution to solution, campground to campground, in this total state of panic where nobody can really talk to you or tell you, take some deep breaths, let's throw out half the supplements and just work with what's here and try and get a plan of and when people can't do that, it is such a sure sign they're being driven by their sympathetic nervous system, by trauma. And if you can't get a person to relax, take deep breaths, and sleep and digest, you just see more and more messes. And some people have a lot of time and money to make messes, and I've watched it. They just keep going.
I think that's such a great point. And I mean, I interviewed Stephen Porges on the polyvagal theory. And of course, safety is such an important concept. Mm-hmm. And, without safety, you can't heal. The body can't heal. And, and you talk about sort of exactly. And you talk about EMDR, and you talk about essentially somatic therapies. And I think one of the challenges that we have, certainly in the UK where I'm based, is that, the NICE guidelines, the main governmental sort of NHS guidelines, are CBT, which is cognitive therapy, essentially. And, that doesn't really work for trauma, and it doesn't really work, and you have to work with the body, and you have to have these somatic therapies. And it's not yet in mainstream medicine to sort of practice these somatic therapies. And so I think it's really great that you as a psychiatrist have recognized that, because I think a lot of psychiatrists say, okay, we'll just do CBT, but that's not going to help.
It's kind of like with your SSRI, and the PACE trial has been, in my mind, totally discredited there with CBT and gradual exercise for chronic fatigue. When people got the data and redid it, they showed that the exclusions and the ones that have been thrown out made an enormous difference on the conclusions which were reached. And I think it's been totally discredited. However, the huge government agency paying for everything is not going to let go of this. And in some ways, there's nothing wrong with getting people to exercise and move. It is just such a good recommendation. And I love doing it without having to say, and we're going to release the trauma of what happened to you as a child. It's like, you're going to do yin yoga and you're going to feel some shaking. We're not, going to keep talking about it and stuff. So I'm very well aware of it. And I do try and get people to at least recognize this is a piece of your medical heritage that is not a shameful thing. It's incredibly common, but needs to be released for the body to access its own healing powers and stop being running from the tiger, being running from whatever, because when you're running, your body is just not going to heal.
100.
And that's Stephen Porges' work. It pretty much sums it up, that's why the vagus nerve is so important.
Yeah. I love that. I mean, you're absolutely right. And then the other thing in terms of the consequences of neuroinflammation, so there's the decrease in neurotransmitters, or the affection of the neurotransmitters, but also the damage to the HPA axis, which leads to the overproduction or underproduction of stress hormones. So the stress hormones are essentially brought out of balance by neuroinflammation. Is that correct?
Yeah, I think that's a great way. It's the dysregulation.
Okay.
Because some people go up, a lot of people go down. It's not as well recognized, for instance, in mold, completely disturbs estrogen balance by inhibiting the aromatase. So basically, you'll see a lot of men with low testosterone, a lot of women with very high estrogens. In fact, to the point they need transfusions, they're bleeding so much. Mm. And that is something, again, that removing the toxins and really can bring back balance in the whole androgen-estrogen balance, cortisol, adrenal fatigue. It's like, I always laugh. Someone comes and says, I saw someone and they said my problem's really adrenal fatigue. And I just stop laughing. It's like, yes, no, it's like, it's kind of like, we're micromanaging, it's like, we're going to ignore the elephant in the room of what's causing it. And yes, you have adrenal fatigue. Your HPA axis is off because of the insult by the immune system, the insult by the hormones being out of imbalance, and the brain itself being inflamed. And one thing is there are mast cells very much in the ventral diencephalon, which is right above the hypothalamus. So you have the thalamus and the hypothalamus. Mast cells are really going to affect it in a profound way, and that's part of neuroinflammation in the brain too. So getting the limbic dysregulation going is going to then profoundly make the panic-driven medicine even harder to try to slow down. But that seems to be, from everything I see when I look at people's brains, is inflammation is going to the limbic system, to the amygdala, to the hippocampus, to the thalamus, and just driving all of this.
Well, it's slightly complicated because it's also what is driving what, like stress, and trauma will drive inflammation of the limbic system, presumably. They'll drive inflammation, but equally inflammation caused by sort of a biotoxin will drive stress. So, you're kind of getting it from both ends.
Right. And that's why we see so many sick people. You're basically, people say, well, it's not just mold, and you're totally right. It's just last straw for a lot of people in being able to do it. And it's the one thing we can fix. We can teach, we can clean up environments. That's why ICI has been so important to me, is because when I started this, mold was crazy, and I knew it was crazy. I knew, I'm trained. This is crazy behavior. To get everybody, at least talking about mold and looking for it and not assuming it's okay is making a difference already in getting treatment. So yeah, they're all contributing. We, have a hierarchy or level of which we found usually moving, starting to work on the major drivers, biotoxins and mast cells, starts to slow down most brains enough. We start to get a little more rational behavior, and that we can work on some of the immune system, some of the infectious insults too, and then eventually start working with the whole heavy metal chemical load everybody has. And in all of that, working very much with ancillaries, foods and exercise and diet, as there's really an order in which you take out the main drivers of inflammation and you can start to work on everything else.
That's fantastic. And then the other thing you talk about is excitotoxicity, which essentially is sort of overactivation of the neurons, which can lead to sort of anxiety symptoms. Is that and
it's glutamate, suicidal ideation, NMDA. Ketamine is sometimes helpful in that, so that's definitely another route. And some of that is genetic pathways. Is just some of us are much more predisposed to not be able to break down our glutamine than others. Okay. And some people, glutamine makes them intelligent and fixes their gut, and for others, it just drives them into severe anxiety. And that piece, I think a lot of it is genetic.
And so the neuroinflammation leads to excitotoxicity. Is that how it works?
Yeah, I would say so. It's, and again, I'm thinking a lot of the causes are TBIs, which create a break. And the blood-brain barrier is supposed to be inviolate. We're not supposed to be talking about it all the time as being inflamed. It's supposed to be a wall in your brain that protects it from all these pathogens and toxins. And it's become quite permeable in people, and things start getting in more easily. And when they start getting in more easily, you're not only destroying some neurons and others, you're setting up pathways and cycles so that they start reproducing more or reproducing the wrong chemicals. And in fact, the microglia themselves are making some of them, and they're getting aggravated. So there are lots and lots of ways, and you kind of, is fascinating. You can look at like, wow, that's how it's presenting in this person, and that's how it's presenting in that person. And I am very interested in that. But
in all the different ways. And,
yeah.
and then in terms of neuroinflammation, we've talked a lot about the causes, sort of trauma, stress, ACEs, biotoxins, infections. You've touched upon heavy metals, food allergens as well, I think you've mentioned. But these are all things that...
This is something I've left out here. I'm sure there's more something to say, but you didn't say this. It's like, yeah. It's a pretty depressing list of what's wrong.
I know. And then in terms of, obviously what we can do about it, you've talked about diet, exercise, key supplements. You also mentioned in your article turmeric and vitamin D as good anti-inflammatory supplements.
Right.
And in terms of protecting ourselves from sort of biotoxin illness, from heavy metals, once we have this stuff, what can we do about it? How can we detoxify? How can we get rid of them? And the other question I have is, you mentioned the sinuses, the teeth. And I know my mother, for instance, who has dementia, and she's always complaining of sinus infections. Her nose is stuffy. She's got this sinus problem. And I really think the two are linked. So how would you suggest dealing with this?
When you get to the level of dementia, it definitely is harder, and that's what we're trying to prevent. But in terms of biotoxins or mast cells, which I've done a lot, is you have to get out of exposure. And when we're seeing all the symptoms, and there are certain labs like urinary and inflammatory markers that are high, it's like there's mold here, and we have to find it. And some of that article is about the inevitable fights that go on, because this involves money and society, and there's usually one person in a couple who's sicker than the other person. And, so there's a whole lot of stress around getting into a clean environment. And in a clean environment, we also start to address some heavy metals, because still, even though we've outlawed lead, a lot of people are still living in homes built before with paint that wasn't properly removed and stuff, or with pipes. So lead is an ongoing issue too in homes. Anyway, getting out of the environment just has to always be at the forefront, because most of us found over the years is until that happens, everything else I'm about to mention doesn't really work very well. After that is we are trying to pull it out, and you can do that while you're still in exposure, but the whole science of binders, tons of different binders, but clay and charcoal work for all of them, have been used safely by humans and animals for many, 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 many years to detoxify themselves. And I have no hesitation saying, look at some of the binders, they're called, available that have clay and charcoal. They're safe.
Yeah.
Other things need prescriptions. They're stronger, they're faster, but you want someone knowing what they're doing. Yeah. And there are a lot of people, if you want to be smart as you start to understand all of this, who take a clay and charcoal binder every night because they know they've eaten stuff that probably had toxins they weren't aware of. They may have been exposed, or they may just be in an ongoing process of unloading exposures from the past. And they feel better when they do some clay and charcoal every day. So it's been used for a long time. So they're binders. And I've always been very interested in the nasal infections. Some of them are bacterial, called marcons, and others are fungal. And most people, as usual, it's going to be a combination of both. Plus, it's sinusitis. Again, the teeth are very linked here to the nose, to the eyes. And everyone keeps it separate. And the brain, we don't even want to talk about. That's a whole different specialty. Is the pathogens are traveling in all these compartments and leading to all the sorts of issues you've heard then about the nerves and the cervical nodes and inflammation. So treating sinusitis is really important for people. And a lot of people have the infection with not even having the sinusitis. When people have sinusitis, the actual rate, you look some studies, I was looking this once, is, the rate of anxiety and depression is like 50% associated with sinusitis. They are the original brain fog people. And that's evidently well known to ENT, not the rest of us, is it makes people very miserable. And if you've ever had a sinus infection, or have allergies, which again, as you get older, more and more you get allergies, that combination is miserable. The brain doesn't work as well, most likely because of toxic influences going very easily from the sinuses into the brain, which we know is meningitis in the worst cases. But we're talking about the slow chronic drip. And your mother is probably quite right. She knows that there are days when her sinuses work and she feels much better than when they don't. I think one thing I know we're going is that I can add is that I think when I started this, I didn't know much about sinuses. I didn't have allergies at the time. I didn't realize you live in Arizona more than 3 years, you're going to develop allergies. I sort of held out for like 12 years at some point. I started getting allergies. Is that they are incredibly common. They are annoying. There is a substance very easily available called Xlear, capital X, capital Lear. It's just xylitol, comes in a little spray bottle. They've actually done some research recently. They showed it killed COVID in a test tube. We knew it's antibacterial and antifungal. That does not mean it's going to cure COVID now if you have it. However, they're doing trials on the prevention, and it was just like chalk another one up for what I've been telling people is, brush your nose the way you brush your teeth, is use nasal hygiene. And my advice for a lot of people these days is use xylitol, exceedingly safe. And for many people, it's like, oh, my sinuses are relaxing. I'm talking. I feel good because it works quite well. And use it in the morning. And then when you come back, when you get back, take off your mask, use it again. As if you wash things out fast, they have some research showing you really decrease colds, even transmission in a household if everyone's using neti pots. So just a word to everybody is Xlear, very easily available and may make you feel better and may be preventive for a lot of things besides COVID, is keeping things from entering all the other cracks and crevices where it starts to grow.
100%. Well, that's fantastic. And ironically, I just ordered some today for my mother by total coincidence.
She'll love it. And just started with the mildest one and get her used to it. But it's much easier to use than a neti pot and sinus. I use a lot of those things, recommend them. We're always trying to clean this out. But Xlear's been the easiest and works the most consistently.
I totally agree. Now, you've been so generous with your time, so we're going to wrap up now. But there was just one more thing in your article. You talked about purpose, a sense of purpose and happiness as also, or eudaimonia, sort of contentment, helping others as being also important for this piece.
Yeah, it's funny how I forget that. And a lot of people I think must do, but the research is there. That at that epigenetic level, the level at which you still have the most control over your genetics, and we all have good and bad genes. If you've done any sort of 23andMe or anything, it's like none of us have a clean slate. It just doesn't happen. We have great genes, we have okay genes, and we have genes that, are dreaded in some ways, and you want to kind of keep those from not expressing. Is the epigenetics, that's the science, that's the safety, that's the vagal nerve too, again, is not turning on your sense of trauma that gets them going, is serving others, is just having eudaimonic versus hedonic happiness, is people who are devoted to their own ends, who are selfish, who have, great cars, great houses, great smiles, that sort of thing. At the genetic level, it doesn't do nearly as much as those people who are out feeding the homeless, giving to the poor, knowing they help other people without, it directly involving their own pleasure and maybe having a cost. So that research has been done, and that is really interesting. And I will still sometimes tell people where I'm really stuck is like, why don't you try volunteering at the animal shelter and walking the animals, which again, with COVID, that's, but in general, is just that's a safe thing for some people is to be able to at least help animals.
Yeah, I mean, that's fantastic. I mean, you've given us such an amazing overview of all these, factors in inflammation and how to lower the inflammation, how to have better mental health, how to support our various pathways, etc. It's so helpful, Dr. Mary Ackerley, and I'm so grateful for your time. I don't know, I think we've covered most things. Is there anything that you want to add?
No, I think when I listen to all of this, and I am beginning to sort of organize my own thoughts to write more for people and stuff, is that, we started out talking like, how do you treat the brain? I started with the smallest things, the small steps every day, like doing Ackerley, or like doing a little bit of exercise, hugging someone's cat, and eating, like dropping the brownies, or at least going to the no sugar brownie, it's like small things every day are going to give you greater gains than like ignoring all of this and then bam, oh my God, what happened to my life? But unfortunately, that is where, I see most people is they get a wake-up call, we call it, of illness, and then have to start back engineering. Absolutely. And that's really where I've seen all the long haulers I've seen so far, no different. Yeah. They got a wake-up call. It wasn't mold, wasn't Lyme, wasn't strep, it was COVID, and they thought they were well, and now they're having to back engineering. So it's sort of a plea for people is, take care of your health in these ways, and you're probably going to do much better without worrying about every single step and every single toxin.
100%. Well, thank you so much for those very wise words, Mary. Very, very grateful. And thanks so much for being on the show. Thank you so much for listening to the Mind Health 360 show. I hope that we've helped you realize that mental health symptoms have root causes that can and need to be addressed in order to sustainably heal, and have given you some ideas about steps you, your loved ones, or clients may take to start their healing journey. Please share this interview with anyone you think may find it helpful, and don't forget to subscribe to keep up to date with our latest interviews on integrative mental health. If you want further information, please go to www.mindhealth360.com or find us on social media. This information is for educational purposes only and is not intended to diagnose or treat any disease or to replace medical advice. Please always consult your healthcare practitioner before discontinuing any medication or implementing any changes in your diet, lifestyle, or supplement program.